This is Cadillac Unscripted 1079 CDY, and we've got Peter Marinoff, Community President of our local hospital, Munson Healthcare Cadillac Hospital, as our guest today on this early December day. And Peter, good morning. How are you?
It is great to talk to you. It's can't complain, doing well. Getting ready for the holiday. How about you?
Same here, and it's approaching really fast. And as you were just mentioning to me, you'd like to see it be a little bit more snowy. I did see something recently that said that we had a 75 to 80% chance of a white Christmas. But I don't know about you, but you probably want to see it be a little bit more than that particular percentage, right?
I'll take 100%. I like the snowmobile, so.
Well, you're in the right area for that. Peter, how are things? Give us an overall update on the health of Munson Healthcare Cadillac Hospital. Just give us an overview of where you're at, and we'll get into specifics in just a little bit here. How are things going?
I have to tell you, I think we're doing pretty well. What's been really nice, to be honest, is we've not had a large number of COVID inpatient cases. So I think that's really good news with how we're managing through increases in COVID cases, and that we're actually taking, I think, better precautionary measures, and we're also kind of just recognizing treatments early on. So I think we're doing well there. As far as the overall health of the hospital, we're doing well here in Cadillac. I think we're going to continue to see what we would call staffing challenges for the foreseeable future. But I think really a lot of industries are seeing staffing challenges. So what we're seeing in healthcare is not unique. And I'm thankful though that our community's doing relatively well, as far as COVID goes.
Tell us the difference, Peter, if you would, at this point between what we knew a couple of years ago versus what we know now, and how we can treat it better.
Well, that's, I wish I had Dr. Whalen here with me. I'd rather have him to help with this one, but I think as we move through the pandemic, there's a lot of things that we learned about the virus. We learned about ways to treat the virus, but also at the same time, the virus itself changed and how it impacted the body. So for us, treatment methods, we were able to apply different treatment methods, but also how we attacked COVID, and really being able to deliver drugs such as remdesivir to patients made a difference. Being able to provide patients with an extra support through various drugs, that helped. I think the vaccination rate, that helped to mute the effects of the virus on many people, so they didn't have to come in for treatment. So there's a lot of moving parts as we've gone through the pandemic that have just overall changed the impact that treating ill have. It's hard to get into the details without spending 4 hours on it, I guess. So we've applied many different ways to approach attacking the virus and helping to somewhat prevent the spread of the virus or muting the spread, and that's made a bigger difference. But also just recognizing the fact that the virus itself has changed, and so have our bodies, and how we're handling it. Sorry, that was a little longer than you probably wanted.
No, that's actually perfectly fine, because that answers the question that I had. Let's go back to the recruiting piece, because you were just mentioning to me that there's this isn't native to healthcare, Everyone is looking for people to work. What kind of things is Munson doing to recruit, quality healthcare providers and quality surgeons and just good quality people to work in your building?
Well, so again, a multifaceted approach. I think what we've realized is that one, it's an onboarding process, and there's a little bit of a recruiting process. So we're actually actively changing some of the ways that we engage people that apply for jobs. So we're trying to actually simplify the application process. So it's speedier. You can access it online. You can get replies right away. That's one avenue of getting people in. Another avenue has been to really do kind of a broader net of where are pay scales at in relation to other healthcare providers, not just locally, but also around the region and the state, and really pushing through the changes that are needing to be made to get to greater parity with our competitors. Because what we're finding is that people can really travel for jobs. And so they could take short-term assignments in other places, and we need to probably be more competitive. So we're looking at that strategy of, okay, how can we make quicker decisions to better align ourselves with those competitors. And then really the third leg is working more on creating a good environment for people to come into. And when I say a good environment, it's really a lot of things go into that, and that's how we engage our teams in decision making, how we engage our teams in kind of having input into their work environments, and really what they need, getting them the things they need quickly, trying to break down those barriers. And then, I think in that same breath, it's putting quality at the forefront and aligning in values that way. So when you're asking, how do we work to recruit in not just good employees, good teammates, but also quality, people that are quality minded? Well, I think it comes by emphasizing quality. So we're really placing a great emphasis on quality and safety. And while we always have, we're trying to share with people more that is our emphasis. And I think you can see that emphasis through our 5-star rating. You can see it through our Leapfrog A rating. You can just see it in various awards that Cadillac's won over the years, that this is a team that approaches quality care very seriously.
Tell me a little bit about the recruiting process, Peter. Obviously it's different in a small town up north versus a Grand Rapids or a Lansing or even a Detroit. Do you find that living where we live is an advantage or a disadvantage when it comes to that?
I think it's a little bit of both, which is how great of a hedge is that to tell you that it's actually an advantage and disadvantage. I think the advantage lies in that we have a great community around here that's a perfect size for people, in that it's large enough to where you can have some anonymity when you go out, but it's small enough to where you know people, you develop neighborly, close relationships with people, and you can feel a bond. So that's an advantage there. I think some of the disadvantages we have is that there is also this desire in healthcare that people want a wider experience in certain areas. So maybe if ER is your specialty, so if you work in the emergency room, you may want to see trauma cases. Cadillac's not going to offer up very many trauma cases. So you might have people that self-select out of applying to Cadillac, and they move to a place like a Grand Rapids. I think our proximity to Grand Rapids and Traverse City makes us far enough to where they may not want to travel, but we are close enough to where people may travel for that. So that's where I kind of say the disadvantage is that we may not have the wide breadth of scope, and we're just close enough to where people are willing to commute. But the ideal advantage is I think the Cadillac community has so much to offer that it makes it an attractive place for people to come to. And if I may also say, a huge advantage for us is our education system around Cadillac. A lot of former students in the Cadillac school system and area school systems, they come back and they get a great foundational education, which helps prepare them for post high school education in the career field.
I find that very interesting, Peter, because I'm in the classroom every day as well with digital media production students, and I can't tell you how many 16 and 17-year-olds come to class every day and say, I cannot wait to get out of this place. And then once they've gone and they've had some college training and some education, they discover, it wasn't so bad there after all.
Yeah, it's kind of the grass is always greener. And I think everybody thinks that I'm going to go somewhere else. And it takes them going somewhere else and taking a look around to realize what they actually had here in the area. And so, yeah, I'm not surprised you hear a lot of that.
Can we talk just a little bit, Peter, about because you alluded a few minutes ago to the awards that Munson has recently won. You talked about the 5-star award, and you talked about another award. Can you talk about the process of how those awards are chosen and what criteria you have to meet in order to win those kinds of awards?
You probably just heard me exhale there. There's a lot of points of criteria for a 5-star rating, for leapfrog A rating. I think probably the easiest way to really sum it up is these are independent rating agencies that take the data that the hospital accumulates and provides. So it's based on quality outcomes. It's based on safety outcomes. It's based on patient satisfaction. Sometimes there actually could be operational performance. So Cadillac was ranked top 20 small rural hospital in the nation for the last 2 years. And so there's financial metrics that go into that because they want to know about your viability as a hospital and how well you're performing overall on that financial side. But there's so many metrics that we track in healthcare that they actually take those metrics and they rank the hospitals according to kind of the performance in various categories. So, but I mean, there's a lot of different data points that are pulled to form those rankings.
Let's talk a little bit about challenges. Maybe the biggest challenges that you see as we get closer to 2023 here. What is the biggest challenge that a small town health organization like Munson Healthcare Cadillac Hospital face?
I really actually, I'll be honest, the challenges that we face in Munson Cadillac is probably no different than the challenges that really any hospital across America is facing. And that is, what we're seeing are some substantial headwinds that we're seeing high inflation rates. We're seeing a tremendous overturn of our healthcare teams. We're seeing, what I would call retirements in healthcare. So we're having to bring on new people in, and then we're seeing kind of with those inflationary pressures on wages and inflationary pressures on supplies, we're somewhat limited with our pricing structure. So for the hospital, Medicare pays us at a set fee schedule. So whereas many other businesses, if they see there's large price increase or large cost increases happening to them during the year, they're able to increase those prices during the year. In healthcare, we have set rates with payers like Medicaid and Medicare, and that's about 70% of our patients in Cadillac. So we're somewhat Cadillac and really most other hospitals around the nation are somewhat limited in how we can really kind of provide a service without taking some financial hits on our bottom line. Fortunately for us, we have a healthy enough volume coming through many services in Cadillac that we've been able to buffet it to this point. But I just kind of looking out over the next year, over the next 2 years, with inflation set the way it is, we're not expecting a large increase from Medicare or Medicaid because of the constraints those government agencies have also.
So as we move forward, we've got a few minutes left here, and we're talking with Peter Marinoff, Community President of Munson Healthcare Cadillac Hospital. Peter, as we get into 2023, what is the big message that you would like to get out into the community here on our show today?
Well, I think the big message I would have is that, at Munson Cadillac Hospital, we're continuing to identify what the needs of the community are and meet the needs of the community. And so one thing, I've been here a little around 2.5 years, a little more than 2.5 years. In that time, one of the gaps that we've identified was consistent OBGYN coverage in the Cadillac area. We made that a priority focus for recruitment. We now have 3 OBGYNs in the area, Dr. Dinah Curran, Dr. Mackenzie Trimp, and then Dr. Kyle Frankowiak has just joined us again. So we're actively engaged with our friends and neighbors to know what the needs are in Cadillac. We're here to support the needs of the community, and that if people see a gap, we ask them to provide the feedback to us so we can look to tackle it. So I'd say the most recent one was OBGYN. The one that we're currently working on is occupational health and medicine. So, I know that we have a large industrial